I'm Dr. Aaron Molen. I practice in the suburbs south of Seattle, Auburn, Enumclaw, Sumner. We got 3 great practices filled with a great team and good patients. There's a couple of different reasons. In particular, they are innovative. I mean, the one thing I love about imaging sciences is they're always working to come out with the new, greatest, latest innovations. I mean, iCAT Flex is a great example, super low radiation dose. I can actually, get x-rays for less radiation using the iCAT Flex than I could with traditional 2D x-rays. I mean, iCAT, they're just market leaders, so it was an obvious choice. It does come up occasionally, and it's a legitimate concern. As a parent, I totally understand that question. In reality, whether you're using the iCAT Next Gen, which is the machine that I personally have at the moment, or you're using the new iCAT Flex, the radiation doses we're talking about are very, very low, and you have to look at them in light of the diagnostic information you're going to get. So are the risks of treating this patient without that information higher than the radiation exposure that's going to occur? And have that conversation with the parent and explain why you need one and what information it's going to give you and how that will improve the care their child will receive. And I've never had anybody give me resistance once we looked at it in that context. Well, you don't know what you don't know, and you can't see what you can't see. So I mean, on a very simple level, simply having information better visualized in front of you is going to make you better at diagnosing. But of course, any treatment plan is only as good as the diagnosis. And so anything I can do to strengthen my diagnostic powers is going to improve the efficiency and the quality of the care I deliver to my patients. Oh, absolutely. I think anytime you make a purchase from $5 to higher, you're going to always look at what is the value that I'm receiving for the price I'm paying. And in my opinion, there's no question that the value iCAT brings in a quality product, the way it's delivered, the support that follows up, and the experience the patients have more than gives value for the price you pay. Well, whenever, the wow factor, I mean, that is one of the best things about the iCAT. Now, of course, we don't take 3Ds just because they look cool, but for sure, when the patient sees the 3D image for the first time and I hand them the mouse and let them spin their head around, they're always just completely amazed that we have in our office the ability to see that much information and then to put it on the screen within minutes. So it not only reinforces their confidence that we know what we're doing as practitioners, but it also allows me to better explain to the parent exactly what's going on, why we're going to do the treatment we're going to do, and why I'm going to do one thing versus another. That's often a question. Well, why not this? Why not that? It allows me to have that frank and honest, open communication with the patients.